Hi, I'm Dr. AzRa Mael. Glad that you're here with us. So I'd like to take a few minutes and just explain a little bit about what I do, the kind of medicine that I like to practice. And I call it sensible medicine, or what works, medicine that works. And it's interesting that for the most part I didn't learn any of it in medical school or residency. I have a lot of respect for Western medicine, especially in acute care. So if someone breaks an arm or has an appendix that's infected and needs to have it surgically removed. But I don't tend to find a lot of value in the Western medicine approach to chronic problems of primarily giving medicines that suppress symptoms. So blood pressure medicines that suppress the high blood pressure slightly without ever doing anything to contribute to finding the cause and getting rid of the cause of the problem. Or I don't have a lot of respect for the medical education process that pays no attention to nutrition and it gives lifestyle considerations like exercise or meditative practices or yoga that just tosses them to the side, because these are the things that are most important for you. And the other thing that's most important for you is educating yourself and learning for yourself what you need to do to manage your health, to take your health as your responsibility and to look forward to the future. So one of the things that I say about the way I eat is I call it life assurance as opposed to life insurance. I try to eat lots of raw foods, fresh vegetables and fruits and sprouts, to juice vegetables, and I'm borrowing that phrase, life assurance, from a mentor of mine, but it's an important concept. So it's all within your control, within our control, our health. And the other thing that I'll say is that if you do have a problem and need help from someone, there are thousands and hundreds and thousands of good ways to help that don't require standard pharmaceuticals and standard Western medicine techniques. And doctors like myself go to conferences and meet with each other and speak with each other and have been compiling programs and lists of things that work and really do get to the cause of the problem. I'm not a purist in the sense that, for me, I'm pretty practical, and it really is about what works. So sometimes a medicine is what helps you cure the cause of a problem, but many times it's not necessary. And so I hope that, I know that doctors have inspired me to be here. I've learned a lot from other people, and I hope that other people, other doctors, really take inspiration and join this path and start to really think for themselves. And for me, the thing that encouraged me more than anything else was my patients and people asking me to help them and to look further and help them find the root cause of the problem. And that helped give me the courage to really step away from the herd and to think for myself and to value truth and to look for truth rather than easy solutions, quick solutions, and the solutions that are really taught to us in medical education by pharmaceutical programs, or the healthcare models of having a 15-minute or even a 10-minute appointment with the doctor for a chronic health problem. You can't get anywhere. You can't get to the root of the problem in 15 minutes or 10 minutes. So it's a system that if you buy into it, it perpetuates the problem. You have to really take control of your own health and step out of that. So step out of the system of the treadmill, the doctor treadmill, where you're in and out, and find a doctor that has the time and space, that's created a model that can actually listen to you for as long as it takes to figure out the problem. So this is Dr. AzRa. Thank you for being with us. So long for now.